And we are back again. I am your host, Roni LeForge, and you are tuned in to Talk of the Town. Here with me in studio for the second half of Talk of the Town is Kelly Reed with RecoverUs. And tell us first a little bit about your business.
RecoverUs is a alcohol and rehab facility here in Carbondale. We are directly behind Golden Corral and are an outpatient facility and cater to individuals who have an issue and know that they want to get better.
Okay, and so talk with us. You said that people are not, like, people have a hard time seeking treatment.
Right.
Talk to us about why that is and how you can help them.
I think at many points in their life, they realize that they need help, either from alcohol or drugs, but they're apprehensive to seek treatment, one, because they think that they're going to have to kind of check out of their lives and go away and be away from their families for 30, 45 days and not work. And that's scary to a lot of people.
Yeah, a lot of people feel like they can't do that financially. They can't be without work, or they, nobody's going to be able to watch their kids. Right. So how are you able to work with them, and how does the treatment that you offer?
So our facility is an outpatient facility. People come in the morning and they leave and go home to their families in the evening, or we treat a lot of people from out of the area. So they'll come down and stay in a hotel or a cabin or something in this area, come in the morning, and then leave in the evenings. However, the treatment is not for 30 to 45 days, but that doesn't mean there isn't ongoing care once they graduate the program. The program is ongoing for 6 months to a year as far as their maintenance. So it isn't a quick fix. It's a lifestyle change in conjunction with treatment and detox, withdrawal management.
And the success rate, I'm sure, is much higher because you do it gradually and you do it. I mean, talk with us about that.
The success rate is 78 to 84%. And that includes, you don't wave a magic wand over someone and say, now you're better. But to get someone where they are an active participant in their care and they understand their goals, and we provide the tools for them to obtain those goals, are really, really important.
So what would you, who is like the perfect candidate for you in Southern Illinois? If anybody's listening to this and they're thinking, I could benefit from a service like that, what would you tell them?
I think the perfect person is someone that has been struggling and not been able to find a treatment program that they felt worked for them, but they know that they have a problem. It's affecting their life, it's affecting their family, it's affecting their health, and they just really don't know where to turn. It's a wonderful treatment program that sees results and help people to get their lives back and their families back.
Is this just for drugs, or is this for drugs and alcohol?
Drugs, alcohol, and compulsory addictions as well.
Can you explain that last one for us?
Compulsory? Gambling, overeating. There's a brain receptor for compulsory addiction. And so each addiction affects various brain receptors. And so that is also included, primarily alcohol and drug detox.
So how does the treatment actually work? What are you doing to help them, and how long do they have to sit at your facility?
The program ranges from 8 days to 14 days. Sometimes can be a bit longer if someone is currently doing Suboxone or methadone treatment. That care can take a little bit longer than the others.
Okay, and how do people reach out to you? Like, if they are interested, do they need to sit down and have a consultation with you before moving forward?
We do not require a referral from a primary care physician, although we do work with a lot of primary care physicians and or counselors. So they can call our facility and schedule a time to meet with someone, do a phone consultation if they're not able or they're hesitant to come in. But we also do walkthroughs of the clinic with a family member. So we just ask that they schedule ahead of time, and we have to, do the proper screening prior to them coming in with temperature and a mask and that type of. But we welcome people to come in and tour the facility.
And you do have an incredible facility.
It's a beautiful place.
I've been there before, and I know that people who are struggling also really value their privacy, and you let them have that there. There are private rooms for the patients to sit in.
Right. Yeah, privacy and confidentiality is so important, especially for working professionals, really for anyone. So there are private rooms. And it isn't an area that's open to the public as far as a lot of street traffic, so people can come in and we'll have the privacy of entering the facility and leaving if that's something that's important to them.
And then in those rooms themselves, they're set up, they have a TV and a bed, just where they can sit in there and receive the, the treatment.
And during this time of COVID, we've had many people that are working remotely. So they're using this time where they're supposed to be working from home.
Yeah.
And they'll come in and, work on themselves and what their issues are and still be able to work, which is a wonderful time to be able to do that.
Absolutely. So is there like a waiting list to get into your facility, or
at times, depending on what we're limiting the patients that we're accepting because of COVID, so we keep an ample amount of distance between each person, and so we're scheduling or staggering the schedule. But it's also important to keep in mind when someone says, I'm ready for treatment, timing is very important.
Absolutely.
Because things change in a week, a matter of days, or a month. So with our ability to work through the weekends for people and accommodate schedules, we do everything we can to make the treatment times possible to get them in as quickly as we can.
And to work with their schedules and when they can get in there. What's the interaction like between the person that's coming in for treatment and the nurses that are there? I'm sure that there is a relationship that is developed.
There's a wonderful relationship.
Yeah.
Because they spend so much time with the individuals, and it's a place where people can come in and they feel very comfortable. It's not about judging them. It's not about preaching to them. It's about helping them to reach their goals and obtain the things that they want for their lives. So we also have counselors, but the relationship with the nursing staff is so very important, and that's one of the reasons that we keep the level of patients down, so they can have that one-on-one with the nurses. So they basically have a private nurse through the duration of their stay.
And I know you can obviously leave names out of this, but is there a success story that comes to mind that you think,
oh my gosh,
wow,
there's many.
I'm sure there's so many, but can you tell us just one that really touched your heart?
We recently had a young father. His family called me on a Sunday evening at 11:30 at night, and they were at the breaking point, which happens many, many times. And I answered the phone, and it was parents of, I think he's 28 years old. He's a young dad.
Young, yeah.
And they said, if we don't get help for our son, we're afraid of what's going to happen. We're afraid of his future. That was on a Sunday night. He came in on a Monday, I keep getting choked, on a Monday morning, and started treatment on Tuesday. When he very first came in, he kept his head down. He didn't talk much. And as time went in the clinic, you could see in the clinic